Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Shrinkage of the prostate gland, flavonoids. When we talk about flavonoids, we are more or less talking about citrus fruits, oranges, lime, and co. And this shrinkage of prostate gland was a topic given to me by a very close friend. He was more worried that I should talk about shrinkage of prostate gland. And I know what he meant by that is how we really prevent this problem of urination, because the prostate gland enlarges in every man. It is a function of the benign prostatic hyperplasia. That is, it is not a tumor, a malignant tumor, but it's a tumor that continues to grow bigger and bigger. And as it grows bigger and bigger, it affects the ability to urinate easily. But the dangerous aspect is the malignant tumor that is cancerous and really cause problem. That is what I shall dwell more on as well in the slide session. But this swelling really affects urination and could be painful. It's not that the swelling automatically means that the urethra, where the urine will pass through, will be constricted, but rather majority of time it is constricted, and that makes urination very difficult. To talk about the shrinkage, more or less, is like you want to talk about the treatment of this benign prostatic hyperplasia, which is a very common problem with every man, because as you grow old, you experience that enlargement. And it has been found in researches that these flavonoids present in citrus fruits, there is this exclusive flavonoid called polymethoxyflavone. It's very exclusive to citrus fruits like oranges, but the one I have experience of is lime, which I used those days. I never looked at the health implication, but I was more or less putting it in my tea with the peel. So it is that citrus peel that more or less produce much of these flavonoids, the polymethoxyflavone, that is very active against tumor. Its effect on tumor is well known, and I can testify that yes, there was a kind of tumor on my laps that period that really got shrinking. It got shrunk, and I can now say that probably it is the effect of the citrus, the lime tea that I usually drink in the morning. Later on, my body started reacting to this lime tea because I started having palpitation every time I drink the lime tea, so I had to stop. But the research on it seems true, because before I started the lime tea, I was very fat, and my triglycerides were very high, over 185, I can remember. But now everything has gone down to, even as at yesterday, I tested my lipid profile, and I can tell you that it's very perfect. This is just a personal experience that will create that interest in, especially my friend, to see whether he can try this thing. But I will expose the therapeutic effects of these citrus peels on this prevention of chronic diseases in adults. It has even been found to be helpful in the treatment of cancers. So let us more or less now look at what role the medical laboratory scientists will play in all of this. The role the medical laboratory scientists will play in all of this is, like I have just earlier mentioned, that my lipid profile that compelled me to be taking this lime tea really went down. It normalized, and I was able to more or less see the effects. It really reduced my weight, as well as was able to take good care of my health before what you may call the side effects. Other things being equal, let's move on into the slide section, where you can have a well-organized discussion on the effects of these flavonoids that is found in the citrus peel, and how it helps fight against tumors and cancerous cells. So by fighting against the tumor and cancerous cells, then it will help shrink the tumors that is forming, the benign prostatic hyperplasia. That is my belief. The outline: objective introduction, research finding, laboratory diagnosis, and recommendations. The objective: to expose the anti-tumor, anti-inflammatory, and anti-cancer properties of polymethylsic flavonoids, PMF, exclusively found in citrus fruit, the age-associated benign prostatic hyperplasia common in men, and also the laboratory diagnosis of prostate cancer. The introduction: flavonoids are antioxidant, anti-inflammatory, and disease-fighting substances widely distributed in plants. Polymethyloxyl flavonoids are unique, highly specialized subclass of the broader flavonoid family. They are found almost exclusively in the citrus genus, oranges and tangerine, and lime. PMF have more than one methoxy group attached to their core structure. These extra carbon-based group replace the hydroxyl, making PMFs highly lipophilic. So it's very fast soluble, and so it could penetrate, and that allows it to be transported via the intestinal lymphatic system, so protected from liver degradation. The other ones are degraded, but this particular PMF is not degraded because it doesn't go direct to the liver. It's transported via the intestinal lymphatic system. So on the other hand, benign prostatic hyperplasia is a normal non-cancerous enlargement of the prostate gland that often occurs as men age due to dihydrotestosterone hormone production. Research findings. Research highlights that lime peels, citrus aurantifolia, especially the green one, that's the one I used to use. Once it's turned yellow, I don't usually use it because I believe it has less production of that liquid that comes out from the peel. It possesses potent anti-tumor properties due to high concentration of bioactive phytochemicals, particularly polymethoxy flavonoids like hesperidin, limonoids like limonene, and coumarins. So these lime peels, how it affects tumor cells? It affects it by inducing apoptosis. The apoptosis has to do with quickly ending the cells, those cells that are already expired, we leave their time, and then it is now degraded. So bioactive compounds in lime peels trigger programmed cell death, apoptosis, in various tumor cells. So that explains the tumor shrinking that my friend is interested in. Inhibiting proliferation, they block the cell cycle, preventing the rapid multiplication and division of cancer cells, so thereby affecting the metastasis, suppressing metastasis and angiogenesis. They stop cancer cells from invading surrounding tissues and restrict the formation of new blood vessels that tumor needs to grow. So that angiogenesis is part of what they do, prevent them from getting supplied these tumor cells. And then specifically the prostate cancer. Research shows that citrus peel flavonoid extracts significantly reduce both the weight and volume. When you are talking of weight and volume, it's like you are talking of shrinking of human prostate tumors in animal models, not in human. Furthermore, metabolic regulations. Research indicates that PMF can help modulate fat metabolism, making them promising for weight management. Just like I said, I use the lime pill for my weight management and anti-obesity applications. These are research findings. Bone health and inflammation. We know inflammation is responsible for many chronic diseases, especially in old age. So PMF directly targets inflammatory signaling pathways to protect against bone loss and joint deterioration. Then the anti-cancer activities of citrus peel is another research of the polymethoxyflavone related to angiogenesis, which I had just spoken about, whereby it blocks the formation of capillaries that will be supplying blood to tumor cells. So it's a very effective agent against that will help the shrinking that my friend talked about. That is, would reduce the progression of benign prostate hyperplasia to cancerous malignant level. Oh yes, the laboratory diagnosis is just to talk about diagnosing the BPPH, prostatitis, or prostate cancer. So what is usually collected is blood samples are collected for a PSA test requiring 48 hours of abstinence from sex or ejaculation for accurate results, because that could affect the results. Less than 4 nanogram or 4 nanogram is considered a normal level, that there is no fear of BPH or anything, even prostatitis. And 5 to 10 nanogram indicates a roughly 25% chance of finding prostate cancer. So in such a situation, you could just continue the usage of the fruits, the lime pill, that's any preventive measure that is known. At that stage, the free and total PSA measurement could be done, and the biopsy will confirm whether it's a cancer. Finally, the recommendations. The prostate-specific antigen is a popular test to screen for prostate cancer. When the values are high, it could be an infection or inflammation of the prostate called prostatitis or benign prostatic hyperplasia. Further tests are recommended, especially if the values keep going higher and higher, to rule out cancer. If it's a case of cancer, then you may need the urologist to really help in the treatment or management of cancer. In my situation, I drank lime pea to control my weight, and it helped in other things that I noticed later, which was the reason for my testimony in this video. Since many old age chronic diseases are associated with metabolic syndrome and inflammation, it is advisable that they reduce their calories and add lime pea drinks to their meal regularly if it causes no side effects like
my own experience where palpitation became a regular occurrence. Immediately I just take the lime drink. It's lime tea with the lime peel, squeeze along. Drop inside the tea so that you can disperse the aroma, the liquid that surrounds the peel. And that I enjoyed the taste so well, but when palpitation attack became another issue, I had to drop it. So although I'm also allergic to coffee and some other things like that, where the palpitation will come up. There are so many videos on this channel, so you can watch more.